as well as the costs of healthcare rationing. You're hearing a lot about that in the newspaper these days. Who thinks Canada is a big rationer of healthcare? I didn't think so. This is a great group. So I'm asking you all to say the words strongly, loudly, repeatedly. The United States rations healthcare more than any country in the industrialized globe. We ration it by race, ethnicity, health, wealth, class status, marital status, you name it, we do it. We don't talk about this. We in public health don't even talk about this, and this is a strategic error. It is a mistake that has weakened our movement. And right now, at this moment in history, unless we strengthen our movement, we are not going to emerge from this health reform talk with making any progress. We can't afford that. Public health professionals must lead the way and talk about the rationing of care, because we, and especially our clinicians, shamefully stand to gain from a broken healthcare system, and that's not the way any of us wanted it to be. Doctors can't fulfill their Hippocratic oath in the current healthcare system. Public health workers can't sleep at night because of the people that we see and the people that we don't see. So at this point in history, we have to leverage this moment to build our movement, and that means building bridges between the single-payer movement and the movement for a public plan. How can we do that? How can we use legislation, the legislative narrative, for a piece of legislation that's not even finalized or crafted at this time to strengthen those movements? That's what I'd like us to consider tonight. I think there's a way to do it. I think there are many tactical ways to do it. And I want you all to know that you in this room are the leaders on how we do it. What I want to most impress upon you is that we must do it. We must build these bridges, and instead of choosing to back single payer, which we know to be the superior model of health for moral, financial, and epidemiological reasons, or the public health plan, we need to see that we need to push for both. That means all of our organizations, professional and otherwise, need to come out in strong support of both, in my opinion. We can use a public health plan narrative to get to single payer for all. And the way that we have done that in this country is through the program called Medicare. Medicare is being compromised, it is under attack, it is being privatized away before our very eyes. It was started in 1965, and the AMA opposed Medicare then. The AMA is now opposing a public health plan. That compromises our movement for single payer, because until we fix Medicare, we will not have Medicare for all. So I'm going to leave the details up to my speakers here. I encourage you to read through this, take a look, and open the cans of worms in each of your groups, in all of your families, and talk about how we can work together at this moment. We're not going to get here again for multiple generations if we fail.
Thank you, Jerry. Dr. J.
I wanted to have the last word.
Oh, I want to have the last word.
Yeah, actually, you can go around another round.
Can I try to do without the microphone? Is that it's a small room? My name is Bruce Trigg. I'm a public health physician, a pediatrician by training. I've worked for 25 years in New Mexico, taking care of mostly hardworking, uninsured neighbors, friends, relatives of ours, and my patients deserve the best option, the best healthcare system, not the one that we can convince the insurance industry and the pharmaceutical industry and the AMA is in their interest.